So I think it's important to recognize that preventing antibiotic resistance really requires a multifaceted approach. And we have to approach this with improvements in how we're using antibiotics, recognizing that they're a precious limited resource. We also have to do what we can to encourage development of new antibiotics, in addition to developing new diagnostics that will better support our antibiotic selection and help us make decisions about when antibiotics are needed and when they're not needed. We have to do a better job of preventing infections in the first place. So there are lots of opportunities there related to infection control in hospitals, but also vaccine development, for example. So it's definitely not going to be solved by any one of these facets alone. And I think that's one important point I want to make, is that we have to work with all these different segments with private industry to make sure that we have new tools in our toolkit to treat patients. There is a perception that antibiotic stewardship may actually be a disincentive for pharmaceutical companies to develop new drugs. But we think about it in the way that actually pharmaceutical companies don't want antibiotics to be administered in a way that would cause patients harm. And so we're actually very interested in working with private industry as well to make sure that our messages are complementary, and that when a new drug is introduced, that it's introduced in a way that's appropriate and that patients are getting the appropriate treatment. I have to say that we have received quite a bit of outreach from pharmaceutical companies that are very interested in making sure that messages are getting out there, along with messages about their antibiotics, about the importance of using them appropriately. So I don't think that they have to be perceived as direct opposition. They really should be going hand in hand. Messages around improving antibiotic use when a new drug is developed, we want to make sure that's used appropriately. The drug companies want to make sure that their drug actually is effective. If that drug is used inappropriately and then is no longer effective because it's been misused, then that's not of a benefit to them or to the public health as well. So I think we can think about this as an ongoing effort that requires the collaboration of many stakeholders, both private industry, federal government, state health departments, you name it. It really is not going to be a problem that we solve by just focusing on improving antibiotic use.